Collagen and glucosamine supplements have become staples in the booming wellness and anti-aging markets, widely marketed as essential tools for preserving youth, enhancing joint function, and maintaining skin elasticity. The appeal is powerful: a simple powder, pill, or drink that promises smoother skin, stronger joints, and a reversal, or at least a slowing, of the natural aging process. But the scientific reality behind these products is far less robust than the industry would have consumers believe. Despite slick advertising and celebrity endorsements, the evidence supporting collagen and glucosamine as miracle fixes for aging joints or skin is, at best, inconclusive and, at worst, deliberately exaggerated for profit. The modern collagen craze rests on the idea that consuming collagen peptides will replenish the body's own collagen reserves, especially in the skin, tendons, and cartilage. While some small studies have shown modest improvements in skin hydration or elasticity with collagen supplementation, the overall scientific consensus is cautious. Many dermatologists and researchers remain skeptical, pointing out that orally consumed collagen is broken down into amino acids in the digestive tract, just like any other protein. There's no guarantee that those amino acids are reassembled as collagen in the skin or joints. In other words, taking collagen may not be much different from eating a piece of chicken or tofu, except for the much higher price tag. And yet the marketing says otherwise. Product labels claim visible wrinkle reduction, glowing skin, and anti-aging from within. These claims often hinge on selectively cited studies, many of which are industry-funded, small in sample size, or conducted without rigorous controls. A handful of positive results are amplified into sweeping generalizations, while negative or null findings are ignored. Influencers and wellness brands play a major role here, promoting collagen powders in smoothies, beauty shots, and capsules with a language of transformation: plump, revive, restore. It's not about evidence, it's about aspiration. The case for glucosamine, widely taken for joint pain and osteoarthritis, follows a similar trajectory. Glucosamine is a natural compound found in cartilage, and supplements are marketed as helping to rebuild or protect joint tissue. However, numerous well-designed studies, including large meta-analyses, have failed to show consistent, clinically meaningful benefit. The largest and most rigorous study in the US, the NIH-funded GATE trial, found that glucosamine, alone or combined with chondroitin, performed no better than placebo for most patients with knee osteoarthritis. Yet despite these findings, glucosamine continues to be promoted as a joint health essential, particularly for older adults. How does such a disconnect persist between science and sales? The answer lies in clever marketing, regulatory loopholes, and the placebo effect. Supplements like collagen and glucosamine are classified as dietary supplements, not drugs, so they are not required to prove efficacy before reaching consumers. Companies use vague claims like supports joint health or promotes youthful skin, language that sounds medical but skirts legal boundaries. Consumers, motivated by fear of aging and chronic pain, try the products and often report feeling better. That improvement may be due to placebo, confirmation bias, or the normal fluctuation of symptoms, but it reinforces the perception that the product works, even when objective data says otherwise. This perception translates into staggering profits. The global collagen market alone is projected to surpass $20 billion by the end of the decade, fueled largely by beauty and wellness consumers. Glucosamine products, long a staple in the orthopedic supplement market, generate billions more. Companies can charge premium prices for products that cost relatively little to manufacture, making these supplements some of the most profitable in the wellness industry. And with low regulatory hurdles, minimal side effect liability, and a customer base eager for hope in a bottle, there is little incentive to apply rigorous science or limit claims. The harm in this overpromotion isn't necessarily acute or toxic, but it is real. People spend hundreds, even thousands, of dollars a year on supplements that may do nothing. Worse, they may delay or forego treatments that are more effective: physical therapy, dietary changes, medical care, because they believe they've found a shortcut. They may also develop a distorted view of aging, expecting that with the right combination of powders and pills, they can bypass the wear and tear of time. When that illusion eventually fails, the blame often falls on the individual for not trying hard enough, rather than on the industry that sold them a false promise. In the end, collagen and glucosamine are not scams in the strictest sense. They are legal, often safe, and sometimes subjectively helpful. but the magnitude of their marketing vastly exceeds the strength of their science. What's being sold is not just a supplement, it's the idea that aging can be paused, that pain can be bypassed, and that health can be purchased in powdered form. That narrative is deeply profitable, endlessly expandable, and profoundly misleading.